last speaker for today, which is a very important speaker, especially during this period of time when we all are looking at our screens every single day. Our eyes are going into fatigue. So I'd like to introduce our next speaker, Dr. Claudine Pang. Is she around? Can she
Hello,
come on board?
I'm here. Can you hear me?
Hi.
Hi.
Yes, yes.
Thanks for having me.
Yeah.
Oh yes, I just saw my patients. I just finished.
Okay. Cool. So let me introduce Dr. Claudine Pang. Dr. Claudine Pang is a retinal specialist with more than 15 years of ophthalmology experience. She graduated with gold medal from National University of Singapore in 2004. She worked in Singapore National Eye Centre for 8 years while obtaining her post-graduation fellowship degree from Royal College of Surgeons in Edinburgh. Dr. Pang spent 2 years at Manhattan Eye, Ear and Throat Hospital in New York, followed by another year in the University of British Columbia in Vancouver, where she received a highly coveted William H. Ross Surgical Vitreoretinal Fellowship. Yeah. Lastly, Dr. Pang spent time in Moorfields Eye Hospital in London, training in electrophysiology and genetic retinal diseases. My apology for the twisting words. Currently, she is the medical director of the Asia Retina Eye Surgery Center, a comprehensive eye clinic specializing in retinal diseases located in Paragon. Being an avid humanitarian, she also founded Eye Quotient, a social enterprise focused on providing free eye care to underprivileged societies. All yours, Dr. Pang.
Okay, thank you. Hi everyone. Thanks for joining in today and thanks for the kind intro. So as you know, I'm a retina specialist and I deal with mainly cataracts, myopia, retinal degeneration, macular degeneration. But today we're going to be talking about something different. I'm going to share about why our eyes are important, frequently overused, and should be getting more rest than we realize. So I'm just going to share my slides now. Okay, can you see my slides here?
Yes, very clear.
Okay, great. So especially during this COVID period, many of us are using our computers throughout the day, more than usual and more than before. And most of us even use multiple devices at the same time, like our phones, our iPads, tablets, our computers, and our laptops. And we even use digital screens to meet people as we're doing right now. And we may even work late into the night. And we could be using our phones or laptops in a pitch black environment, which really puts a strain on our eyes actually. So digital eye strain is a very real problem, and I've been seeing a lot of this more recently because of the COVID. And it happens due to extended hours of digital screen usage. It's also called computer vision syndrome. And already before COVID, research studies have shown that 70% of computer users have digital eye strain, and I'm sure the numbers are much higher now. How do we know whether we have digital eye strain? Okay, the symptoms are you have tired or fatigued eyes, you also get headaches, and it might even come as a blurry vision, which is intermittent, it comes on and off. And you will have difficulty in focusing, like if you look from somewhere near to somewhere far, you'll find that it takes a longer time for you to actually focus. You get neck aches as well, and you may even have eye pain, eye discomfort, and soreness. So did you know that we actually blink less when we stare at a computer screen? Okay, why this happens is because when we stare at a computer screen, we concentrate a bit more, and we will tend not to blink as much at a less frequent rate because of the concentration. And some of us even have an incomplete blink. That means if we blink too fast, instead of the eyelid covering the entire eye, it will cover only the top half. So that we call it as an incomplete blink. Why do we need to blink? You know, we have a tears which coats the surface of our eyes, and these tears actually provide like oxygen and nutrients to our eyes. And each time we blink, this tear film is replenished. Okay, how do we see the tears? We actually stain it with a green dye called fluorescein, and this allows me to see our tear film, whether it's healthy or not. Look at the picture over here on the left. This is a normal tear film. You can see the green dye is spread evenly across the whole eye. On the right side, you can see that there are dry patches which start to appear. Where do you see these arrows? And this is because our tears actually evaporate, and it causes these dry patches if we don't blink. But each time we blink, it will replenish the tear surface. So it's important to have a good blinking rate. If we blink less, then our eyes will dry out more easily. So I've been seeing also more cases of such eyes. These dry eyes which have microscopic abrasions. If you look at this picture, you can see over here at the bottom surface, there is a lot of green dots which are permanent, which means that they are actually small little holes or pits within the surface of the cornea. And this happens because people are using their computers excessively over time, blinking less, or if they don't get enough shut eye, so their eyes are open more often in the day than usual. And this can present as painful red eyes. So I see a lot of patients coming in for this problem. And some of them tell me, oh, you know, I sleep 3 to 4 hours a night. And I'll tell them 3 to 4 hours a night is probably not enough because it means that your eyes are open for too long. Okay, and then next, tired eyes also brings about inadvertent eye rubbing. So how many of you actually realize that this is true? When you're tired, you tend to rub your eyes. This is because when your eyes are overtired, over-fatigued, there will be inflammatory mediators that are released, and this causes itchiness. So we tend to rub our eyes hard when we're tired. And rubbing is bad, so we should not rub our eyes under any circumstance. Why? Because rubbing leads to a whole lot of different things. Firstly, it can lead to astigmatism. Okay, astigmatism is a condition where the cornea of the surface becomes irregular. So a person with normal vision would see things clearly and lights would come across as circles. But a person with astigmatism, the lights would have radiating rays from it. And I think many of us know that, yeah, some of us have astigmatism and it's usually correctable with glasses. But eye rubbing actually makes astigmatism worse. So this is important to tell your kids as well, not to rub their eyes. Eye rubbing also leads to certain cornea injuries, for example, cornea abrasions, as seen over here. And it can lead to conjunctival bleeding, which means there can be blood seen over at the white of the eye here. And it also can lead to a dislocated lens. So recently, I just saw a patient that had rubbed his eyes rather hard, and he came to me with a dislocated lens, which requires surgery, so I had to fix the lens back. And in the worst case scenario, if you rub your eyes really way too hard, it can even lead to retinal detachment. Okay, so this is another common condition that many of us might have experienced. It's called eyelid twitching or blepharospasm. Everyone must have felt this at some point in our lives. And you think, oh, someone's talking behind my back. But no, actually, when we have eyelid twitching, most commonly there is a local eye irritation. The eye is too dry or feeling uncomfortable, and there is stimulation of our eye muscles to cause this twitching. So when this happens, it could be a sign that you are overworking, and it was a sign to say that you should take some rest and massage the eyes gently, not too hard, so that the eye twitching can stop. Okay, ocular migraine. This is another condition that I've seen more recently during this COVID period. I see a lot of young adults, they come to my clinic complaining of this condition in which they see flashes of light. And these flashes of lights are usually moving, and they move throughout the visual field. Why this happens is because there is actually poor blood flow due to vessel spasms in the brain, causing these flashes of light. Okay, let me explain more about migraine. I think some of you may have migraine, and in migraine you get headaches, and you get these headaches because there are vessel spasms in the front part of your brain, the frontal lobe, and that's why you feel the pain. But in ocular migraine, it's a little bit different because the vasospasms happen in the occipital lobe, which is the back part of the brain. And when that happens, you don't feel any pain. You might not have a headache, but instead you have funny visual symptoms instead. And these visual symptoms, we call it scintillating scotoma, and this is what it can look like. You will see various colors. It can be rainbow, or it can be black and white, or it can be gray, any color, and it will be a bright light that flashes and moves at the same time. And it usually moves around your visual field, like in a circle or in an arc, just like what this video is showing. So this is pretty common, and you'll find that most patients with this condition will feel better after they have slept or taken a nap for about half an hour or so, and then these visual symptoms would stop. It can be accompanied with headache, but more often than not, there is no headache. So that's why the patients get really upset that, you know, they think that they're seeing something abnormal and it's something bad to do with their eyes. But when they come and get a check, their eyes are perfectly well, but actually the spasms are occurring in the brain. And what are the causes of this migraine? Most frequently is due to fatigue and stress. That's why I've been seeing it so often recently. And also due to excessive caffeine intake. So people who drink lots of coffee and also alcohol, and even certain types of food can be a trigger. And for ladies, it's due to hormonal changes. So you'll find that, yes, it correlates with their usual menstrual cycle monthly. Okay, so I just wanted to make a side note that all of what I had described is also applicable to children. So children who use their screens excessively, it's harmful because it can lead to progressive myopia, especially if these screens are way too close to the face, as in this picture, which is not correct. And if they're using it too much, or if they get tired and they start rubbing their eyes, all these will lead to irreversible damage in future. So it's important that children as well, you know, you should tell your children to not use the screens so excessively, and that they should take breaks and frequent rest. So I'll go on to how can we take care of our eyes then. You know, good sleep is really is underrated. So most people don't know that having a good night's sleep is important for your eyes as well. So I have a lot of patients who sleep only 3 to 4 hours a day, and they come to me with lots of eye complaints, and which all can be helped if they just put in some good hours of sleep. You know, even if they can't really sleep, I'll tell them that they have to close their eyes or get a shut eye for at least like 7 to 8 hours, because it's important that our eyes get renewed tear films and not be so dried out all the time. In the day as well, it's good to even take a short nap. Sometimes a short nap helps to recharge the eyes and even the body and your mind. So it's important to take naps in the day as well, especially if you're tired. Okay, what about blue light? Blue light is always the question on everybody's mind. Does blue light harm our eyes? Okay, it's what everybody wants to know. Well, in medicine, we believe in science, so we can't make any claims unless there is some scientific proof. To date, there are no studies at all that can show that blue light directly harms our eyes or retina, okay? But however, we do know that this blue light does in fact cause our eyes to be more uncomfortable and fatigued. So yes, blue light does make our eyes more tired, but it does not harm our retina based on the studies that we have currently. And secondly, we also know that blue light does disrupt our sleep cycle as well. In fact, it's advised that we do not expose ourselves to blue light from screens or digital screens for at least 2 hours before sleep. I think you'll find that if you or your children use digital screens close to at night before they sleep, you might have difficulty sleeping after that. And that's really because of all the excessive blue light that we are facing. So there is merit in using blue light screen filters on our computer screens, laptops, or in using these blue light filters in our spectacles. And these spectacles, usually they look like they have a purplish tinge on them. And when you wear them, they make things look a little bit yellow. So people find that when using these blue light filters in our glasses, it allows our eyes to feel more relaxed, more comfortable, and less tired all the time. So yes, but just so that you know, these blue light filters do not filter 100% of blue light. Okay, there is no such thing. In fact, these glasses only filter a maximum of 40 to 50% of blue light, and that is all. Because we still do need some blue light for normal health. If a person is filtered 100% of blue light, it's also unhealthy because we need this normal blue light for our mood stability and for not causing depression and things like that. So we just need a balance. So everything in moderation. So we shouldn't not have any blue light at all. At the same time, we shouldn't have any excessive blue light. So for those of us who do not use our screens or digital screens very often, then I would say it's not necessary to get these blue light filters. It's only for those who use it excessively and you're finding that you're having trouble sleeping at night, then yes, it will be good to use these blue light filters. One other way, if you don't have a blue light filter, is you can use the night mode on your phones. So you know the iPhone or the Android phones, they have a night mode, and that night mode in itself already cuts out more blue light. That's why when you see it, it appears more yellow, the screen. So it's enough to do that as well. Okay, so when you're doing work on your computers, you know, it is important to have good lighting, and by that I mean good ambient lighting. It can't be too dark, but at the same time, it can't be too bright either. So you shouldn't be like doing your laptop when there's lots of glare coming in from the window. It should be a right balance so that your screen is illuminated well enough, but yet there is a good contrast to allow you to see what is in your digital screen. If you use a screen that has too much glare and you're like back facing the window, then there would be too much glare and you would not have enough contrast to see the words on your screen. So it's important to use an anti-glare screen. And if possible, what you do is you would put your digital screen at the side to the window. That means the window should be on this side like it is now, or this side, but the window should not be behind or in front of you because that would be too much glare. Good sitting posture is definitely very important. I think just now Mr. Joseph Wong has already talked about how you should sit in your chair posture. Now what I'm trying to tell you is the distance of the screen to your eyes. It should be an optimum 60 to 80 centimeters. It shouldn't be too close, and 60 to 80 is about an arm's length or so. That would be just right. And the angle at which the computer screen, it should be about 20 degrees lower to your eye level. And why is that? Is because when we look upwards, our eyes tend to get tired and more dry out easily. So we should be looking downwards slightly, just 20 degrees below your eye level. So that is the optimum arrangement for your digital screen with respect to your eyes. Okay, taking visual breaks. This one would probably be the most important and the one that I can't stress more. It is advised that you take 20 minutes, for every 20 minutes, you should take a 20-second break and look 20 feet away. Okay, this sounds a little bit unrealistic because if you're working very hard, you might not remember to take a break every 20 minutes. So, okay, we can do it at half an hour or 45 minutes to be a bit more realistic, but as long as we're taking these visual breaks, then it would be helpful in order to give our eyes a break. So when you do that, it would be best to look out the window, look out to somewhere far away. That's why I always encourage like having a window near your working space so that you can frequently look out of the window. Even when you're thinking, you can just take a quick break and look outside. Because what that does when we look at the distance is it relaxes our eyes and it doesn't put a strain on our eye muscles, which are always contracting when we're looking at a near distance. So we should try to do that frequently, and then you'll find that your eyes are less tired. And then it also includes that if you're feeling very tired out, you can just close your eyes for a few seconds, because that even allows you to have a complete blink and complete eye closure. As I told you just now, you remember a lot of people have an incomplete blink. That means when they blink too fast, their eyelid does not cover the whole eye at all. So the tear film is not replenished. So if you take a few seconds to have a complete eye closure, then there will be a replenishment of all the tears in the tear film. So that takes me to this, which is to make a conscious effort to blink more frequently or close your eyes completely. This really helps to prevent dry eyes, and helps when you have dry eyes, you tend to feel tired. So you want to relieve the fatigue by making your eyes more moisturized. And by that, you can also do it by lubricating. And I mean lubricate with natural tears, such as these ones. Always choose preservative-free eye valves, which means if you use an eye drop which comes in a bottle, usually if it's bottled and it lasts for a month, it means that there are preservatives in the bottle which help to keep the bottle uncontaminated. That's why there are preservatives. But these preservatives may be harmful to the eyes in long term because it can cause allergies and even ironically cause dry eyes. So we want to choose preservative-free eye drops. And if they're preservative-free, they usually come in these small little vials. They are one-time use. That means after it lasts for 24 hours, you use it one valve a day, and then the next day you would use a new valve. This prevents any contamination. It keeps the eye drops clean, and it's always a new one every day. So this is gentler to your eyes, more hypoallergenic, and you can use these preservative-free eye drops as often as you like. And a lot of people are always concerned. They'll say, what if I use too much eye drops? Is it harmful for my eyes? Will I get addicted to it? Or no, there is really no such thing. Actually, lubrication is really useful and beneficial to our eyes. So we can use lubricants as often as we like, as long as we choose the preservative-free ones. So when we lubricate our eyes will become more moisturized. There will be a better tear film on the surface of our eyes, and there will be more oxygen supply and nutrients to our cornea and eyes as well. So it's important to lubricate. Okay, so then I'll end off by saying that if your eyes are red and painful, or if you see flashes of light like what I described, or even floaters, it's important not to self-medicate. There are some of my patients who go to use their own medication that they get from either the pharmacy. Some of the medicines in the pharmacy that are sold are, say, vasoconstrictors, so they help to make the eye less red. But they are not the long-term solution, and they actually harm the eyes in long run. Other patients, sometimes they get steroid eye drops also for the eyes. It makes the eyes feel really good initially, but in long term, steroid eye drops actually cause cataracts and glaucoma, so it's not good. So don't self-medicate. The most important thing is to get seen by your eye specialist, because it could be a more serious condition, such as the ones that I haven't covered. They would be glaucoma. Glaucoma is when you get high eye pressure in the eye, and it leads to permanent eye damage. Can be uveitis, which is an eye inflammation. Can be blepharitis, which is an eye infection, in fact, that leads on to a stye or chalazion, which is a swelling or redness, like a little pimple at the eyelid. It can be cataracts or retinal tears, detachment, or even macular degeneration. So this list usually, I mean, it affects us, later on in life, and if the symptoms are also similar as red and painful, flashes of light and floaters, all these need to be seen by an eye specialist if you can. So yes, this is my clinic. It's at Paragon on level 15. So if you have any questions, you can always text us. We have a mobile that is open for anyone to text 24 hours a day. Over here you can see, and you can even send in email as well. So do you have any questions?
Okay. Thank you, Dr. Pang, for your very detailed sharing. I have a couple of questions that have come forward. I'm going to ask you the questions, and if you can keep the answers quick and short, you can run through all the questions.
Okay.
How to massage the eye to stop eyelid twitching?
Yes, so normally...
You want to off your
okay.
screen? Yeah.
Okay, so normally, if you don't have eyelid twitching, or you don't have anything abnormal, it is not recommended to massage your eye or do any kinds of eye eye exercises. It is not necessary. There is no merit in that. But if you have an eyelid twitching over at one corner, it will be helpful if you get a towel. You you can make the towel warm. Like under a running tap, hot water can be like 40, 50 degrees, a little bit warm. And you can put it on your eye, and then just, you can hold on to compress for a while, or you can just massage a little bit like this with a palm, so over a palm, so that you don't do any damage to the eye, because our eye is really protected by our orbit wall, which is the bone around the eye. So if we use our palm to massage on it, you are unlikely to cause any damage. But if you use your fingers or your knuckles and start rubbing, or your fingers to press in very deeply, you would be likely to press too hard, cause too much pressure, and that may damage the inside contents of the eye. So remember, always palm. If you need to do anything, just hold it for a while in order to release the eye twitching. But if the eye twitching persists and doesn't go away, then yes, you need to be seen by eye specialist, because we have other treatments that can help eyelid twitching.
Can diabetes patients become blind if they do not take care of their sugar levels?
Oh yeah, definitely. So sugar levels is very important. If it's too high, what can happen is it leads to abnormal blood vessels in the retina, and that can cause bleeding. Once there's bleeding in the eye, it would lead to lots of floaters and eventually loss of vision in the eye, which will require surgery to remove the blood. Other than bleeding, high blood sugar levels also cause the retina to swell up, get swollen. That's called macular edema. So when that happens, we also will get poor vision due to that, and it requires eye injections to treat.
Okay, thank you. Is it good to use eye drops frequently? More likely when you wear contact lenses and when you feel your eyes are dry? Like you mentioned just now, as often as possible, right? Doesn't
Yes,
matter
actually it is okay to use eye drops. It is not harmful at all, especially if you use preservative-free ones. Yeah, I'm not speaking about the other kinds of eye drops. Yeah, so natural tears, preservative-free are okay.
Sure. As we are using the computer and electronic usage during dark areas, will that cause increase in myopia?
So myopia is caused by excessive near work. So I have to say it's a combination. If you're using in a dark area, I think you will tend to bring it closer to your face or eyes in order to see what is on the screen. So yes, if it is too close to your eyes, it will bring more myopia. And in a pitch dark environment, it brings more strain to the eye is because the eye muscles will be overused. In a pitch dark environment, our pupils tend to dilate, so they will want to dilate. But yet you have a screen with a lot of glare staring in your face, and so your pupils will want to constrict. So that conflict will bring about a lot of strain on all the eye muscles, and therefore your eyes will feel tired.
What does it mean when we just have a single eye pain? That means on one eye, we have the pain, but not on the both eyes. Is there something to be more concerned about?
Yeah, because if you have single eye pain, well, it could mean that that eye in particular, not always we will get dry eyes in two eyes. We could have dry eyes in two eyes, but one eye will be more severely affected than the other. So it could just mean that that eye also has more severe dry eyes than the other side. And the other thing also could be glaucoma. Sometimes when we feel eye pain, it could be because the pressure in the eye is higher. And it is sometimes asymmetrical, meaning it may not happen in two eyes. So then we would have to check in order to see whether the pressure in that eye is truly higher or not. Yeah, so even if you have pain in just one eye, it's still important to get a check actually.
Which is better for reading, yellow light or white light?
Yellow light or white light? Oh, okay. Well, I would say that in the yellow light, it is a little bit more. Okay, yellow light has less blue light. White light has more blue light. So in yellow light, you will feel more comfortable and less discomfort. So in white light, it may be bright, but for a prolonged period of time, you may feel tired more easily.
Does regular eye strain cause eye bag, or is it just because of lack of sleep?
Yeah, so eye bags is most likely due to, firstly, lack of sleep. When you get lack of sleep, what happens is that the eyelid areas, the skin here becomes a little bit thinner and the blood vessels become more prominent. So you can see more dark circles. That is lack of sleep. But the eye bags, the ones where you see protruding of a little bit of fat tissue, that one occurs with age as well. So with age, there is sagging of the eye skin and eye fat around the eyelid, and it droops down, and that appears as eye bags. So it's a combination of aging as well as, you know, the color, the dark color will be because of lack of sleep. Mm-hmm.
That's probably my problem, aging. I'm wearing spectacles. Should I get LASIK eye treatment? I heard LASIK treatment can last for 3 to 5 years. Will it be recommended from your perspective, from your point of view?
Okay, so in order to know whether you are a good candidate for LASIK, I first have to know your age. So because age is very important. In a young person, like say 20 or 30, yes, LASIK would be a better solution. But if you are above the age of 40 or 50, then LASIK might not be the solution for you, because it's usually at that age, an older age, where you have other problems such as presbyopia is one that we call 老花, and also cataracts at that stage. And if you have either of those at that stage, LASIK might not be the best solution for you. There will be other options like even cataract surgery, etc., etc. So age is a very important question.
You know, sometimes we have a dot in the eye, like a spot on the eye. Is the spot in a fixed place? Is it a problem?
Is it in a fixed place or is it a floating dot?
A fixed spot. See a spot on a fixed place through one eye.
Okay, yeah, then in that case, it's not so normal to see a spot that is fixed on one eye. Probably you should get a check to see whether there's any cause for concern, anything in the retina. If it's just a floater, which means it moves around like a mosquito that you can't quite catch, then that could be more benign. Yeah.
Okay. So I think we have come up to 12:38. We have burst the time. But I would like to thank all of you for being here, and Dr. Pang for spending the last half an hour sharing with us your insights about